Case how I do natural fillers is a patient that wanted to restore her face and do it really in a natural way just to get a little bit more facial balancing. She lost some weight. She wanted to just essentially provide some volume, but she didn't want that puffy, overdone look. So I achieved this really with collagen stimulating products. Mostly what I did was with dilute forms of Radiesse. Worked incredibly well for this patient. You can see a beautiful, beautiful result for her. So take a look and see how we could achieve natural results with filler. And we also did a little bit on her lips as well. So you can see that really softened up her facial features. And what's nice is that she got to keep these. This is actually her skin quality improved. She no longer had some of that laxity that had happened with some of her weight loss. She just felt like it was just like really like there was loose skin there. She felt like she was getting a little bit of jowling and like was really just looking a lot more gaunt. So we got a really, really beautiful result over here. Initially, actually, she didn't let me share photos, and then she like saw her after photo and was like wowed by it. And she's just like, sure, yeah, you could share it. And I really appreciate that. Every once in a while, someone does let us share it, and like they're sort of like wowed by the whole thing. It's like, yeah, I wanted to kind of educate people and showcase people that you could do this really safely and do it so that it still looks really natural, still looks really soft. It doesn't not have to look like it's puffy or overdone. So what I personally like to do, especially with patients like this, is more with like collagen-based products. So I usually use more things that are essentially Bellafill, which is bovine collagen, or I use Sculptra, or I use Radiesse. And the ways I determine that really it depends on how much volume loss there is and like how much laxity there is. So if there's some patients when the skin is really loose, we may want to do something like Radiesse for those patients, like a dilute form of Radiesse, because it stimulates elastin production, and the elastin production can help actually tighten the skin. If there's a lot of volume loss, then we would do something like Sculptra, for example. So it just sort of depends on what we're looking at, what we're seeing with each individual patient. Sometimes, there are times where I do want to do a lot more volume, and we may just need to do like Sculptra and potentially like a hyaluronic acid filler. What do I think about ProCell treatment? I think that's ProCell is a stem cell. Is that right? Let me just double check ProCell. Let's see here. Yeah, it's a stem cell treatment. I don't do stem cells. This is microneedling stem cells in the skin, and I don't use stem cells. I do collagen stimulating products, and things with stem cells I just think are really sketchy. I've yet to kind of find anything that is approved by the FDA. FDA has actually gone out of its way to actually to put a letter out there saying don't use these things. I guess I could take a look and see some of the studies that they put out there. A lot of the studies that a lot of these companies come up with aren't the best, but I could take a look and see kind of what's going on with this and who's involved with this. Carla's saying, I've been dealing with fungal acne for 2 years, itchy and bumpy. How do I get rid of this? Well, the easy thing to do is just to try ketoconazole shampoo, is really just try to start with that if it really is true fungal. But you just go through and see from a physician, a dermatologist preferably, what's going on with your skin and if it really is fungal acne too. I'm not sure if you've done anything. Let's see here. User 11 is saying, doctor, is this something I could afford? Is it pricey? Well, it depends. When we're doing like fuller volume restoration, like this particular patient, this could get there probably to like $4,000 to $7,000 potentially. So you could do it in stages sometimes, but it could get there. It's like $4,000 to $7,000 probably what somebody would pay for that. And I did somebody's full volume restoration today. Looked amazing, looked incredible, and really, in her case, I actually did from the side of the profile right there, like the side of the forehead, all the way down to her chin, and like just did everything and really balanced it out really, really beautifully for her. PDO threads. What did I think about PDO threads? A crosshatch pattern on the cheeks. So I used to do a lot more with PDO threads. I found that there was a lot of complications that I was dealing with in the area. People were sending me a lot of their complications because I do a lot with subcision, and sometimes it was getting pulled down. It was essentially getting tethered or stuck with the barbed threads that are PDO threads. And I found that just, it wasn't lasting as long as I would like to. Sometimes, for some patients, when it's relatively loose skin, or if they are essentially have a lot of volume loss. Actually, this patient right here, she initially thought that she should do PDO threads and wanted to do PDO threads. But PDO threads aren't going to give volume. It's and I think it's pretty weak in terms of collagen production, maybe a little bit of collagen production, but you definitely can't get the kind of collagen response that you could get with biostimulators like Sculptra or Radiesse or Bellafill. So that's ultimately what we ended up doing for this patient. It worked out really well. So patients that are gaunt, like this particular patient, it would really be unfortunate to insist on doing PDO threads for her. If you're going to be doing it and still going to look okay, it's just not going to last that long. And she really needed more volume there. How many CCs have you had in your face where, I'm not sure how many CCs offhand, but I've done mostly Bellafill. I did a little bit of dilute Radiesse at one point too, but mostly Bellafill really for like my forehead, my temples, my cheeks, my chin, my jaw. And yeah, I'm pretty open about what I've done. So if you feel, I saw like one time someone was like on my comments, oh, the doctor's gotten like Botox done and whatnot. It's like, yeah, okay. So it's like, I don't know why we have to like put, like, why are we putting, like, why mention stuff like that? Okay. First of all, it's, I think it's necessary for a lot of people. I think it really helps actually with mood too. Sometimes if it's like really heavy frown, things like that, it's really great. For people, it just relaxes your frown, and people feel better. Actually, I think it's really, really nice that you could do that. You could just relax your face like that. Sometimes it's not even necessarily people are angry, but like when they're concentrating, they sort of just get like this heaviness over there. Actually, it's interesting. I really don't have much movement just in general in life. I was like, when I was like 12 years old, I didn't want to like move my head too much, but I still feel like a strain sometimes in like my 11 area. Like I never really had like the full movement there, but I still like the strain. So like right now, I haven't had Dysport in several months, and I feel like it's like a little strong, like my headache almost right there. So I have to do that again. So it's like, it's really good for headaches. It's really good. It's really good to like balance out the eyes, open up the eyes, things like that. How much Sculptra did she have? I actually didn't do Sculptra in this patient. I did dilute Radiesse. I believed we ultimately did about 4 of those over here for her. Let's see here. And we also did her lips as well. How to get rid of hyperpigmentation, darker skin, laser, pico, or microneedling with chemical. So I had a patient today. She was South Indian, and she was told to do microneedling with PRP. Didn't help for her pigmentation. PRP, microneedling, it's not going to help really with pigmentation. It could actually potentially even make it worse. So the best things are really going to be low energy lasers if you're going to use a laser. Otherwise, topicals are really the number one way of doing things. Also, sunblock, of course. You want to really start that process before you use a laser. But if you're using a laser, I definitely, she was told by someone else, she said that someone told her to do Fraxel and do CO2 laser. Absolutely not. Darker patients really could get rebound pigmentation issues with that. But pico laser, if you do it properly, you could actually do okay with that. I think that's that you're not going to really run into a problem there. Let's saying, what do you think about about subcision for boxcar scars? It's okay. It just depends on if you need it. For some that are really deep boxcar scars, deep, thick ones, yes, you would do it for that. Otherwise, probably not going to be too helpful. You may just want to go right to doing something like Bellafill. Jessica Ardell saying, do you offer fat grafting versus filler? Do you recommend it? Yes, actually, the patient I showed yesterday, his was a fat transfer result. And it depends on what we're looking at. If there's a lot of volume loss, then fat transfer could be a great option for you. And then we could do like small little spots of something like of a Bellafill, or we could potentially do like a Sculptra in those little spots, things like that. Let's take a look and see what's going on with you. But fat grafting is awesome. And then we could also put like the stem cells from your fat cells and put that and re-inject those into your scars, which works out really well. K. Araman is saying, what would you say is the most effective for old rolling scars? By far, subcision. It's really, really good with that. Just subcision is the best. Williams is saying if I like the effect of PDO threads would give me, should I just get a mini facelift? It depends on how much volume loss there is there that's causing that skin laxity. You may actually have, potentially with certain age groups, it may actually be the buccal fat that's actually herniating out, and that could potentially be what you should remove. And I know people say don't do buccal fat, and the people who are saying that shouldn't do buccal fat, because sometimes the way they do it is they make a huge gash in the middle of their cheek and are taking out good fat as well as the deep fat pocket, and that's not good. But if you just only target just the buccal fat, it could work out really, really well in the right candidate. Do you offer BBL? Yes, we do a ton of BBL. We usually use it for acne patients. I don't use it as much for rosacea or for post-inflammatory hyperpigmentation. I think, I have XLV. I think that's better for it. I think that for pigmentation, the Pico laser is better for that. Mikos Faye Fines is saying, what is good for hollow eyes? I just turned 40. So when you're looking at your eye area, take a look and see really when you're feeling like your cheeks and see if there's an indentation in your mid cheek area. You can kind of sort of feel if there is an indentation over there. Usually by the time you're 40, there's probably going to be some volume loss in the mid cheek, and you likely are going to need to do a little bit of volume in the mid cheek area. The way I do it over there, that's what I did for this patient today too, was I went deep to the bone and supported the ligaments in the mid cheek area. And then actually her under eye area improved quite a bit with that. So I didn't even have to touch her under eyes. It looked incredible actually for her. What about Erbium laser? Erbium is great. I do it all day. It's usually my go-to for like more of a superficial blending effect for when I do my acne scar treatments. Also, it's really good just as like an anti-aging process. I typically do it like myself every 6 months or so. I definitely have to do it soon. I've been pushing it back because I just hadn't had the time, but I definitely want to do it at some point again. What does BBL do for acne? So you could do the 420 wavelength with it, and essentially it'll just kill the bacteria. And then you could also combine that with other wavelengths depending on your skin type for like some of the redness of acne too. Jacqueline was saying, I was wondering what was done to her under eyes. In this particular patient, I did a little bit of filler directly underneath the eyes. I put just a little bit of hyaluronic acid filler there as well. I usually don't do too much. This is, I'm Dr. Qazi, by the way, those who don't know, if you're those just joining, I'm over in Newport Beach, California. And a lot of what I do is with skin restoration. In this case, with this patient, she was worried about the amount of volume loss she had really just throughout her whole face, and really, really critical for her. She wanted to look very natural. That's what she came to me. She knows I just do a natural approach. And so I did what I really do is global volumization and just facial balancing over here. And so I did a dilute form of Radiesse, and I put that along the cheek area to help out a little bit also with the nasolabial fold. I also did it right underneath the zygomatic arch, right in front of the ear, the periauricular sulcus. I did some of that over there. Really helped support it. Did a little bit in the temple area as well. And you can see, I also did a little bit with her lips with hyaluronic acid filler and in the tear trough area. I know I missed a few questions here. Let me try to get to some other people here. Wow, it looks great. I need something like that. How much should I save, doctor? I believe most people for something like this, like global restoration, it depends how much volume loss there is if we do like other filler, but it's probably like $3,000 to $5,000. Some people it could be like a little bit more, a couple thousand more potentially, but most is like $3,000 to $5,000. Let's see here. What is my opinion on gua sha for facial sculpting? So gua sha is not bad for lymphatic drainage, but it's not really going to be for facial sculpting, but it's not bad for lymphatic for that purpose. For essentially like areas like there's a little malar edema, you have what's called a festoon over there. It could help sort of sometimes release that, but it's usually a very temporary effect that really not going to help too long though. What do I think about Erbium laser for olive skin? I do it all day, every day. It's just how you do it. There's a certain way to do it. I know that there's some people who basically do a little bit too aggressive with it, but there's ways of it really getting it appropriately as long as you pre-treat the skin there. Let's see here. Sonia's saying, is this a result of one session? She looks amazing. Yeah, this is a result of one session in this case, actually. Sometimes we do it more like staggered. In this case, I did this under a single session for this patient. Let's see here. Mario is saying, how come your TCA Cross doesn't leave red dots? Other providers always warn about redness. There's some redness sometimes in some spots, but I actually don't use that high concentration with it. And that's actually one of the secrets that not secret, I say it all the time on here, but I say to people all the time that it depends on the depth of your scar. Sometimes if it's deep, I am going to go and use a little bit stronger concentration for those. But I know so many people that, and really when I started it, started going through and down this whole route, and I was looking in my own scars, seeing that people said, don't do TCA Cross, that's going to be bad, blah, blah, blah. And it turns out like so many people in this world were doing 100% TCA Cross on everybody. Every single scar they saw, every single patient, didn't matter what skin tone it was or anything, and they were doing 100% TCA Cross. One of the patients I just saw today for a consultation, he was calling from Puerto Rico, actually, Fitzpatrick 4 patient, and he's telling me that they don't even prep, the person he went to didn't even prep his skin for his laser sessions. And it's like, Fitzpatrick 4 patient, and they're doing a CO2 laser. And then I saw him and they went really, really aggressive in one area. And it's like, this kind of stuff is like really, really reckless sometimes. And, then people say, well, don't do lasers, don't do that. Well, I mean, don't do lasers with someone that does stuff like that, honestly. And don't do TCA Cross with people who are splashing around. Really, it's like people were splashing around. I think that now people are gotten a lot better with it, but like it was just unacceptable the way stuff was. I knew people, and like one of my buildings that I was in, like it was like they were showing me like the TCA that they were doing, and it was like dripping all over the face. I had a patient that they were did a TCA Cross on, and the practitioner put like a fan over the face while they had the acid, and the acid went all over her face. She had a chemical burn from the fan while doing TCA Cross. I mean, this is like really unfortunate stuff that happens sometimes. And I don't know if people realize that like you really like need to do things like really, really effectively and like just really properly in order to do this and touch this. If you can't do it properly, just don't touch it. Like leave it to someone else to do this, because it's like you should not be touching certain tools and certain devices if you think you need to do 100% TCA on every single scar. It really just like it needs to be like very, very clear out there, just to like not touch patients anymore. Ryan is saying, what are the price averages for only 1 or 2 deep scars? Is it the same as full face treatment? I'll have to see. I'm not sure what's involved. If we have to do excisions, things like that, it's usually probably not going to be the same just for that, but I have to take a look and see, honestly. Let's see here where I was at. Microneedling with exosomes versus PRP. We only use PRP for ourselves. I don't do exosomes in my practice. Like I've said before, it's just not FDA approved. And in fact, the FDA put a letter out there against it, so that's why I don't do it. But I know people do it. I know that some people swear by it, things like that. I don't know. I'm not sure if there's going to be something that shows up one day and they find out that there was a cancer risk or something like that happened due to this stuff. We're finding so much stuff right now from like just the food that people are eating and things like that, all the dye that people have, that there's cancer risk. It turns out that like benzene, which is in benzoyl peroxide, has potentially a cancer risk. So it's like, I don't know, like some of the stuff, it's like who knows what's out there right now. And the FDA put a letter out there, so maybe that means the exosome companies didn't really talk to the FDA enough or something like that, or didn't have the right connections. I'm not sure, but like they put a letter out there, and that's what they said. So it's like kind of a bit reckless to do it then. Let's see here. Tears of Geisha saying, I love wrestling lists on the Kiss. I feel like I only need more after over a year. Yeah, some people just last a long time. One of my patients that came in today, I've been working on her for a while. Actually, you've seen her result before. And I hardly touch her lips really, because it's just like, it holds, like it just holds like that. You don't really want to ever put too much in there. Miriam saying, have you ever treated someone with severe cystic acne with Accure and it fully went away? Oh, yeah, definitely. I mean, I have to see if any recent patients have let us share some photos. I know some people haven't been sharing the photos recently, but I'll try to find some more with like severe cystic acne patients to showcase it. But absolutely, yeah, there's been excellent results with severe cystic acne. In fact, that's one of the things that I think really shines with actually severe cystic acne. Really oily skin, severe cystic acne works really well for that. What about Easy Gel with PRF? I used to use it. I didn't find it improved outcomes at all, so I just used regular PRP. And I've always said that I don't think that anybody's ever been able to show that something like PRF is superior to regular PRP. If there is something out there, I'm happy to take a look at it. You know, you show me your studies. If you're an easy PRF rep out there and you're upset about what I'm saying, just show me your studies and like kind of properly. I don't want to talk to the other doctors. I don't want to talk to your sales reps. I just want to see like the actual studies, and we can kind of go through it, and we could go through it together. We could go through some of these studies together. Actually, I probably actually this week, what I'll do, I'll have it put together. We'll talk about the studies that we went through for PRP and acne scars. We put up together a few of the studies there, and we can kind of go through a little bit about what those studies showcase, just a little bit about like the basics of it, just, you know, nothing too intense, but just an overview of it and what we sort of think about those studies. And so you can take a look at that. Do you offer a cure for back acne? Yes, we do. Yeah, we absolutely do. We do a cure for back acne, and it works incredibly well. Actually, I have a patient who had actually done AV Clear before in the past, and then ended up doing a cure, and it worked. He said it was just so much better. So, and you know, now he's like 6 months out or so. It's just significantly better. Lilies and Flowers is saying, hello doc, may I ask best treatment to fade after acne spots, red pigment scars, Fitzpatrick 4. Probably the easiest thing for you to try is going to be azelaic acid. Try 10% azelaic acid. Try it. It's usually going to fade it a little bit over the course of like 3 months. If it's not fading it enough, then talk to someone like myself, and we could do lasers like XLV could help out with that. How much is under eye PRP? I don't know offhand. I don't think it's much though with us though, honestly. Go ahead and take a look at our page. For those who don't know, you could go to my page, drqazi.com, and we have a bunch of our prices just listed over there. So just take a look. Yeah, and it's pretty open. You know, most of our procedures are on there. Even some of our surgical procedures that my partner does are on there. You know, we're pretty open about what we charge. I want it to be open over there. I don't really care if like people want to compete and all that stuff, because it's like, I just know that in order to compete with me, you're going to have to do things at a consistently high level, the way that we do, and you're going to have to outwork me. So it's like, good luck with those things. If you could do it, then sure, you know, I'm happy because there's more than enough patients out there. But, you know, I'm open. I'm going to showcase how I do my things. You could take a look and see how I do all the things step by step on my videos, and, you know, do it. Go for it. Because like, I want the world to be like at a higher level. The things that actually upset me are not people who are doing things at a really high level. The things that upset me are people who say that they do things at a high level, and then I'm doing so many of the revisions and so many things. It's like, what were they even doing? Why did they do 4 subcisions on this patient? And, you know, they claim that they're a specialist or something like that. And then like, there's so much scar tissue still in there. Why did they do that? Like, why was that acceptable? Why did they do so much, you know, TCA Cross or phenol cross, and it made the scars worse because of the way they did it? You know, like, it doesn't do it for me. So I'm not sure why I'm revising your cases all the time, and like, just don't do these things. Don't do this anymore. That's kind of what I want to get into. I want to have it so that this is less of the people that are kind of doing like the nonsense treatments, the stuff that like just doesn't work, or like they're just being lazy as they do it. I want those guys out. I want those guys just to not do stuff anymore. That's actually what I want. I actually don't care anymore. Like, I just don't want them to work anymore. And like, I'm tired of it. I don't like, I'm not interested in like their excuses, like in their arrogance with the way they talk and everything like that. And it's like, you know, they made all these statements, all these claims. So many of these people that were pushing filler during my time, they thought I was crazy for doing, you know, collagen stimulating products like Radiesse and like Sculptra, things like that. I had a person at a conference tell me, why are you doing that? Because you're not gonna have a patient come back and forth then for the filler. And I was looking at them like dumbfounded. Like, honestly, these are, and you know what the wild thing is, that same person that does that, sometimes I see their page, and during like the height of, you know, this Holocaust that we're inflicting, they're like pro-genocide. And so it's like the same kind of mentality, the same kind of person is also like trying to nickel and dime patients like this and say these kind of ridiculous stuff. And so it's like, to hell with all that stuff. Honestly, I'm tired of this stuff where it's like this influencer culture within like this world where they push nonsense treatments, and they were insisting that there's these experts, and they're telling people to do a bunch of hyaluronic acid filler and it's going to dissolve over the course of a year. Well, guess what? It didn't dissolve after a course of a year. And, you know, I was showcasing with ultrasound over and over. I had actually one of the executives from Allergan right next to me, and I was talking to him, and I was telling him about the issue that I was having with Vicross, and he's just, you know, denying that I was existing. It was saying that there's, you know, it's just a user error. It's just because of, you know, they're not keeping the skin clean, blah, blah, blah. And you're seeing it over and over and over again. You're seeing it on their ultrasound for years later, and they had no explanation for it. They just didn't care.
And that's like the state that we're in right now. You know, it's all this nonsense stuff that like is just so totally like these influencer guys are running around and they're getting bribed by these companies, bribed by big companies to like push certain products, push a certain way of doing things. And then you walk around Beverly Hills, you walk around Newport Beach, and you see like the effect of that. You see what happened. It's like thanks to these guys, thanks to all those influencers who are pushing nonsense garbage stuff and telling people that like, oh, hyaluronic acid filler is going to dissolve over the course of a year. And now it turned out it takes like 8 to 12 years sometimes the way you guys were injecting it, which was way too superficial. And you know, everyone was pushing cannula for like hyaluronic acid filler, pushing it into people's like mid-cheek, all that stuff. And it's a disaster. Like I said, just walk around town in like certain areas, you'll see like, it's just like, look at that. Like that's the effect that these guys caused because of like the way that they push filler on people. It's terrible. It's a terrible situation out there right now. And if you look at it, it's just so unnatural out there right now. And it's like, we got to actually kind of like rewind and kind of go back to like some of the basics and look at this and say that maybe we should like, you know, take a look and see not just what kind of products we're doing, but also who is pushing those products. Maybe we should double check that. Just see like, why were they pushing those products? Is it like revealed who's getting these, who's going to, you know, there was a big neurotoxin company that launched and they had all these influencers. They flew them out to like a resort in Mexico and they were like going on and like then they came back and were pushing on everybody and it turned out it wasn't as effective as alternatives. And so it's like you are pushing a product that wasn't as effective and you're not revealing that you were compensated for this. You know, you went on a trip to do this and now you're pushing the product. It's wild. Like, I don't know, like, you know, when this is going to stop, but it really needs to stop. And, you know, at this point, it's like, I'm just so over it. I'm so tired of like having it over and over and over where patients are just botched completely. And then I have to fix this stuff. I'm happy to fix it, but like, it's upsetting though. I look at it like that patient that like, they put like 20 vials of filler in him and a man that like didn't need it. He's a young guy. And like you look at his face and he was like trying to like achieve a certain aesthetic and they made it so that he had like these huge cheeks, huge like chin and like jaw, everything, his lips. And it's like so unfortunate, so unfair they did that to him. This poor man who was just trying to like improve a little bit and improve his aesthetic a little bit. And they just saw like these dollar signs. Let's just like shove a bunch of filler in this guy and call it a day. You know, it's like, really unethical. Like, and they were making these claims that like, you know, if you don't get 6 vials right now, it's just not going to be enough and blah, 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 blah. It's like, really, why did you need 6 vials when I could do this in 2? Like, why did you need that? Why did you need 6 vials like that? Why didn't you use collagen stimulating products? And then they're making these claims like, oh, filler is going to lift. It's going to lift up their nasolabial fold. No, it's not. Now they say it's not going to be. Now those same guys who are pushing it, now they know that filler doesn't lift. But at the time, they were telling everybody, they're telling all the patients, everybody, that filler is going to lift, it's going to do this, it's going to do that, and it's just like a facelift or, you know, all that stuff. And it wasn't even close to that. You know, it was never like even, it was never designed for that. It was basically supposed to actually just lift up the certain pocket of volume loss, but it certainly wasn't going to like structurally fix the jowling that they were trying to claim and that kind of thing. And they were doing like these photos of people with jaw lines and stuff like that. And they'll look at from the side, it looked great. It looked amazing. It was like a really nice sharp jaw. And then you look at the woman, I had these women in front of me, and it's like really boxy and squared off and really like just unnatural look. And it's really unfortunate that like that same person was like this influencer in this industry and was pushing it and was just like, and was telling people all this ridiculous stuff that you have to do this many vials and nonsense stuff like that. And it wasn't true. It wasn't true. And like I said, they literally will tell you, why should you not do, like you should do hyaluronic acid fillers. That way the patient keeps on coming back to you. So they knew that collagen fillers were superior, but they insisted to do hyaluronic acid filler for some patients because they wanted the patient to come back because they think you could squeeze more money from the patient. Like, unbelievable, right? Like, instead of like, to me, it's like, I want to be proud of the fact that like my work, if I see my patients all the time walking around, it's really amazing. I love it. It's like awesome. It's like awesome. I see you walking around the park. I see you walking around the mall, see you walking wherever. And it's like, you guys see me walking around and it's like, I'm happy. You're happy. It's like, I'm like looking at this, like you look super natural. You look great. And that's what I want to have. Like, it's like where we are, even if I'm like somewhere else, like a different city, I have patients all over. So it's like, I want to like be able to walk around and like just feel really good without like anybody, like I'm like looking at that, man, shoot, I shouldn't have overfilled that person. I'll feel terrible. Well, the worst is actually some of those guys don't even recognize it. Those guys don't even look at it. They're looking at someone like this, someone that's like overfilled, and they're like looking at it like this is a normal, great look. You look so great at this stuff. And it's like this own little bubble that they're in, that this is like the aesthetic that they're trying to achieve is like this bubble, like puffed up look. Really too bad. People lack empathy and compassion. And unfortunately, I've talked about this before, even in the healthcare industry, I used to think when I was coming into this that a lot of people really were also like empathetic and really wanted things for the right reason. And there's so many different things that people went into this for. I think though, like people were asking what my fellowship training was and all this stuff. I actually went to internal medicine. I think that helped me out a ton. I think it helped me empathize a ton with the full system going from head to toe. I think, when I was a resident, one of the most defining moments ever, it was really like the first week of residency. We had to do, I did a code on a patient who was 22 years old, and pretty much for like 11 hours straight, me and my co-residents were going back and forth to code this patient. She's 22 years old and given birth, and she coded afterwards. She had a cardiac arrest afterwards. It was the worst experience of our life, but we did it. We pulled through. We got her through the night. She didn't make it ultimately, but we tried our best. At least our shift, she made it. And it was like a defining moment. It's like we did it. We put it through there. We put that in there. And like that was our belief. Like as like all my residents know how I was, all of us were like the same way, that like we did it. Like we were like, if somebody was like sick, we put ourselves, like we would go through a wall to like make sure that this could go, we will make sure that we could get the best possible outcome for patients. And so that helped a ton, so like we were able to do that. We were like, able to empathize, go and like, after you do that, now talk to a family and see how that is for people. And like, you just tried to code a patient for that long, and now go and look at the family in the eyes and tell them that that this happened. It's a terrible sensation. It's terrible, honestly. And do that over and over and over again. And it's like, some people get jaded, but like, honestly, I think it was excellent for us. Like, it was like the fact that we had to go through that, the fact that we went like that and we shared that experience, it's like, it's very, very different. And I'm glad we got through it like that. That's why actually when I was doing med school too, I worked at like county hospitals on purpose, because I wanted it to be like, I wanted to work with the people that were living in the tents on the street. I wanted to work with them. I wanted to actually have like provide high level quality care with that. That's what I wanted to do actually. It was actually really important for me just to be able to achieve really, really great results in that world still with patients who were living in tents on the street. I wanted that because it's like they had like terrible conditions. They didn't have proper health care. And it's like, there's something that we could do to figure it out. Especially I was working in the burn unit a lot. And it's like, there's a lot of severe burns, and it's like amazing to be able to like pull people through with that stuff. So that's like, I think the journey that like, makes things unique a little bit. And it provides a little bit more like of a empathetic approach to certain things. And I think that like some people that are in like the other fields of medicine don't necessarily get that empathy. They don't really get it. They never looked at a patient's family in the eyes and, day in and day out, and talk to them about how difficult the situation is and how you're working on it. But it may not happen. We may not be able to pull through. And it's really a tough conversation to do. It's really tough, and then it's like really tough, not during residency, but like sometime like afterwards, like it's really tough that you like worked really hard on your patient and then you hand it off to some doctor who is just doing it for like fun and doing it for a shift and doing it for whatever reason and doesn't care about it. And you save that patient's life and you hand it over to another doctor, and then the patient died, or some terrible outcome occurred, or like they put the patient on the wrong antibiotics, whatever happened. And it's like terrible. It's like so unfortunate that you're sitting there, you worked so hard to save a patient's life and do all this, and you hand it over to someone else. And that's why I had to get out of that system. I was like, this is just like I have no control over this right now. And why should I be involved in this right now where at least with this, I can control this from start to finish. And I could make sure that this is where I could do, and I could do a very, very high level, and it's on me to make sure. And that's why, and people ask, are there adverse events? Sometimes there are, but I fix it. Let's say I do get post-inflammatory hyperpigmentation. I'll fix it. I'll keep on working on it, keep on doing it to fix it, to improve it. Because like, I'm not gonna let you with worse skin from what you started with, and I've never had that. I've always left better. So it's like, I will work on doing that. And instead, I've talked to other people. 3 of my patients have told me that they got burned by a doctor, somebody people know, and they got burned by them, and they were told to get like hundreds, if not thousands of dollars of skincare to fix the burn that was caused there. It's wild, actually. Wild behavior, actually, when you actually think about it. It was burned because he used an inappropriate laser or inappropriate peel, something like that. And then they're being told to spend hundreds, if not thousands of dollars in extra creams. And like the wild thing about the whole thing is that, they were telling me when I was going to do your own skincare line, all that stuff, I was like, 100% not doing my own skincare line like that. 100% I'm not doing that because I know I grew up with acne. I had acne for a long, long time. Ever since I was like 12 years old, I had bad acne. And so it's like, I knew that like, with acne, it's like you don't need expensive skincare. I tried everything. You don't need expensive skincare, and you don't need to do all that stuff. So, and it's wild to me that the guy makes like, even if there is an adverse event, he's telling patients to spend hundreds of dollars on his own skincare line or his own shop and things like that in order to fix the problem that occurred right there. It's wild. And here I am, and I just work on it and fix it and work on it and get them to do like, as minimal expense as possible, and just do it and just try to get this so we could get them through the hurdle, because I want them to feel really good about themselves. So, I think it's like, there's got to be like some sort of reckoning in our medical community, honestly. At this point, like, it's just like, it's gotten way too far. It's like at some point, like there needs to be something where we could look back and look at this and saying that this whole system, this needs to change from like start to finish. Every aspect of it is getting so corrupt now. Tears of Geisha saying there's a bunch of rude people working there too. Like, who can I trust? I'm not sure which place you're talking about, but it's some other office I think you're talking about there. Is there any type of filler that helps with jowling? No, you need a facelift or neck lift. You need to do that. Oh yeah, well, Tears of Geisha saying they tried to sell $2,000 worth of skincare, mentions the person's name. So let's see here. Practicing at the highest level with the utmost ethics is the foundation of my practice too. Awesome, Nurse Carla. Awesome. Yeah, I'm glad that that's the case. I really hope that like that stays like that. I know people can get jaded. I know every single one of us knows that we deal with sometimes patients who try to sort of bend the rules or sort of try to exploit like the way we are, things like that. Like all of us deal with that. But the difference is that some people like just get like jaded with that. Some people just like it really brings them down. Other people, it's like, just if you look at it in a whole, if you look at like pretty much with the exception of 1 or 2 people, it's like people really just want the best thing for themselves. Like they just want to like improve themselves. They're not looking to like trick someone else. All they're trying to do is like they're investing a lot of time to go to do any procedure. Even the patients sometimes have to, like the patient that did filler today, unfortunately she was waiting a while. Like if I'm doing a procedure, I'm sometimes stuck in the procedure. Like I'm going to just finish it. My staff knows not to interrupt me. I'm just going to finish it. I want to finish what I'm doing. And if I'm doing a particular spot, I like to stay focused and stay like in my rhythm and concentrated with that area that I'm doing it in. And they know like that. So I'm not going to be interrupted with that. So it's like, I have to finish it, and I want to finish at a really, really high level there. So it's like, it's going to be done properly. So people know that. And so like sometimes they wait and but they still get a beautiful result like this. Like when I'm now focused on you, like we can get that. And so it's like, everybody knows that. And I think it's awesome. I think that like the patients that come in, I do try my best to try to move on, move forward and things like that. But sometimes it's like every once in a while I'm stuck in a procedure, and it's like, hopefully you guys understand that. Like sometimes it happens, like you would want me to do the same thing with you. Like you want me to just to finish it and do it really, really well for you. Jay Dre is saying, what procedure did this patient get? This patient, she got dilute Radiesse, she did under eye filler, and she did a little bit of lip filler for herself. So we did dilute Radiesse, and also I did a little bit of structure along her jawline with a little bit of, and her chin with a little bit of Radiesse too, tiny little bits of that. Let's see, I know I went a little bit overboard, but I'll try to finish up with this right here. Jasmine saying, how do you prep darker skin for a TCA peel to prevent hyperpigmentation? Usually I don't do TCA peels in darker patients, I do TCA Cross. Dr. Qazi, how do you deal with impatient patients when you're running behind? First of all, I try my best. If they really are getting late, I will try my best to absolutely try to accommodate you. I know I know your time's valuable. My time's valuable too when I'm in an office, in a doctor's office. I totally understand that. I'm like, believe me, I do. I'm actually going to try my best to try to work with you and get and make it happen. When I'm there though, when I'm actually, ultimately going to be there, usually it's not going to be hopefully too long of a wait, but when I am there, I'm focused on you. I'm going to make sure that you get a really, really great result. And I'll just make sure like you really, really get a beautiful result with us. So that's the thing. Like I work through it and kind of make sure that that's the process for us. And we'll help you out with everything else. So just let me know though too, if we feel like you are waiting a little bit too long, let my team know there's ways that we could kind of figure out how long it's going to be for me. And then hopefully it's not going to take too long with that. Jasmine saying, I'm interested in doing a peel very soon. I mean, TCA peel, I probably wouldn't recommend for darker skin type though, just so you know. Probably would not recommend that though. So it depends on what's going on there. User 36 saying, would you do any treatments on the same day as consultation for acne scars? I probably wouldn't. I usually want to prep the skin, but you could do like Bellafill. You could potentially do subcision that day, depending on what we're looking at there. Let's see here. Is it super effective for volume and restoring skin? Let's see here. I think you're asking about PRP. No, not really effective for that. It's more just going to help with the skin itself a little bit with the skin quality. It also helps with the healing process. Is it safe to do PRP? Yes, it is. It is safe to do that. Lami's asking, do you accept observerships electives? Yes, I do. Yeah, I do. We actually are going to have a dermatology resident with us next week, I believe. I think next week, November something or other, early November, I think. So yeah, we do a lot with that. Usually it's more resident level, but I could take a look and see what level you're at, and we could try to work with you, see what we could do. Jay Dre is saying, how much downtime for subcision and laser? Usually about 4 to 7 days for that. Usually 4 to 7 days. How do I contact you? You could just go to our page, drqazi.com, and there's actually in there, there's a form. If you're trying to do the training, you can do Academy and do it that way. We're kind of way behind. We had a lot of requests for training. I'm not really doing any training for the fall time other than this dermatology resident right now. Anything more because we're super jam-packed, I should say, with our patients. And so I don't want to actually kind of delay anything with like teaching or anything at this point. But next year I should be able to just have some more slots in there for teaching there. Hopefully that'll help you out there. And I'll be happy to. Like, as long as you're like want to do things at a really high level and you want to work hard, I will teach you and I'll show you. Like, and just like, don't be unethical. Don't try to like sell your own skincare line for like $3,000 skincare products of like moisturizers and stuff like that. Don't do shady things like that. Don't like push like random products on people. Just do things at a really high level and we'll get along fine. That's really my big thing. Like I just don't, I'm happy to train people, but I also don't want to train people who are just like gonna nickel and dime everybody and like do reckless stuff. Like that's, and I just don't want somebody like to say that they got trained by me and like they're sitting out there like doing shady stuff like that. So at some point I am gonna like add more people and like put some things like, we have a few actually already on our page of people that have been trained with us, but we'll keep on adding people on there as, as well, just to kind of get it so that it's pretty clear for people that this is who, this is who we work with and we feel comfortable with. And usually they train for a while, like some of it, like, weeks or a month or so. And, feel really comfortable and confident with their skill set at this point. I'm going to finish up over here. Mario is asking, will Erbium or CO2 laser help with dark spots at the base of ice pick and boxcar scars? Probably a pico laser is probably the best option for that. And then also we'll answer the other question, which is which laser for skin of color. Pico laser works well, or even an Erbium laser could be a good idea for you guys. All right, guys, thanks so much. Appreciate you for coming on tonight. I will see you again tomorrow.